In the next few minutes, we'll explore 10 silent causes of swollen legs that affect millions of seniors worldwide. Before we start, consider subscribing to the channel and ring the notification bell. Now, let's dive in. Cause 1. Poor circulation and chronic venous insufficiency. The first silent culprit behind swollen legs is poor circulation, specifically a condition called chronic venous insufficiency. As we age, the tiny valves in our leg veins that help push blood back to the heart begin to weaken or fail completely. Think of these valves like one-way doors that should close tightly after blood passes through. When they don't work properly, blood pools in your lower legs, creating pressure that forces fluid into surrounding tissues. This pooling happens gradually, often without pain, making it easy to dismiss as normal aging. Ignoring poor circulation can lead to skin changes, ulcers, and blood clots. Taking action improves comfort, reduces swelling, and maintains your independence and mobility for years to come. Cause 2. Heart failure and cardiac issues. Your heart's ability to pump blood efficiently affects every part of your body, including your legs. When the heart struggles to pump effectively, a condition called congestive heart failure can develop silently over months or years. As the heart weakens, blood doesn't circulate as efficiently, causing fluid to back up in your circulatory system. This backup forces fluid into tissues throughout your body, but gravity pulls it down to your legs and ankles. The swelling often appears gradually, starting as slight puffiness that worsens throughout the day. Early intervention makes an enormous difference. Monitor your weight daily, as rapid weight gain often indicates fluid retention. Work closely with your healthcare provider to monitor your heart health through regular checkups and appropriate medications when needed. Cause 3. Kidney disease and impaired function. Your kidneys silently filter waste and excess fluid from your blood 24 hours a day. When kidney function declines, a process that often happens gradually without obvious symptoms, your body struggles to eliminate excess sodium and water. This fluid retention affects your entire body, but the effects become most visible in your legs and ankles due to gravity. Kidney disease can develop slowly over years, with swelling being one of the first noticeable signs that something needs attention. Supporting your kidneys starts with proper hydration. Drink adequate water to help your kidneys function efficiently, but avoid excessive salt that makes them work harder. Monitor your blood pressure regularly, as high blood pressure both causes and results from kidney problems. Cause 4. Medication side effects. Many medications commonly prescribed to seniors can cause leg swelling as an unexpected side effect. Blood pressure medications, particularly calcium channel blockers, diabetes medications, and anti-inflammatory drugs, can all contribute to fluid retention. These medications work by affecting various body systems, and sometimes fluid retention is an unintended consequence of their primary action. The swelling typically develops gradually after starting a new medication or increasing a dosage, making the connection easy to miss. Never stop medications without consulting your healthcare provider, but do bring swelling concerns to their attention promptly. Often, alternative medications can provide the same benefits without causing fluid retention. Timing adjustments or dosage modifications might eliminate the problem while maintaining the medication's benefits. Cause 5. Sedentary lifestyle and lack of movement. Modern life often leads to prolonged sitting or standing, creating a perfect storm for leg swelling in seniors. When muscles remain inactive for extended periods, they can't effectively pump blood and lymphatic fluid back toward the heart. Your calf muscles act as a secondary heart, squeezing veins and lymphatic vessels with each step. Without regular movement, fluid accumulates in your lower legs, creating the puffiness and discomfort you might experience after long periods of inactivity. A sedentary lifestyle increases your risk of blood clots, muscle weakness, and falls. Incorporating regular movement improves circulation, maintains muscle strength, and significantly reduces leg swelling while boosting your overall energy and mood. Before we continue with the remaining causes, I want to hear from you. Which of these first 5 causes resonated most with your experience? Have you noticed a connection between any of these factors and your leg swelling? Share your insights in the comments below. Cause 6. Lymphatic system dysfunction. Your lymphatic system operates as your body's drainage network, collecting excess fluid from tissues and returning it to your bloodstream. As we age, this system can become less efficient, leading to a condition called lymphedema. Unlike other forms of swelling that might fluctuate throughout the day, lymphatic swelling tends to be persistent and may feel firmer to the touch. It often affects one leg more than the other and can develop gradually over months or years. Untreated lymphatic dysfunction can lead to chronic swelling, skin changes, and increased infection risk. Proper management maintains tissue health and prevents the progression to more severe lymphedema that significantly impacts daily activity. Cause 7. Protein deficiency and malnutrition. Adequate protein intake becomes increasingly important as we age, not just for muscle maintenance but for proper fluid balance. Proteins in your blood, particularly albumin, help keep fluid within blood vessels rather than leaking into surrounding tissues. When protein levels drop due to poor diet, absorption problems, or increased needs, your body can't maintain proper fluid balance. This leads to swelling that often appears first in the legs and ankles, as gravity pulls the excess fluid downward. Protein deficiency weakens your immune system, muscle mass, and healing ability while contributing to persistent swelling. Maintaining adequate protein intake supports overall health and helps your body regulate fluid balance naturally. Cause 8. Hormonal changes and imbalances. Hormonal fluctuations, particularly in postmenopausal women, can significantly affect fluid retention and leg swelling. Changes in estrogen, progesterone, and thyroid hormones all influence how your body handles sodium and water. These hormonal shifts can make you more sensitive to dietary sodium and more prone to retaining excess fluid. The swelling may seem to appear without obvious cause and might fluctuate based on various factors including stress, sleep, and activity levels. Work with your healthcare provider to evaluate hormone levels and discuss appropriate hormone replacement therapy if suitable for your situation. Focus on lifestyle factors that support hormonal balance, including regular sleep schedules, stress management, and appropriate exercise. Cause 9. Blood clots and deep vein thrombosis. Blood clots in the deep veins of your legs, known as deep vein thrombosis, represent one of the most serious causes of leg swelling. While clots can form silently without obvious symptoms, they often cause swelling, pain, warmth, and redness in the affected leg. Seniors face increased clot risk due to factors like decreased mobility, certain medications, recent surgeries, or underlying health conditions. The danger lies not just in the leg swelling, but in the potential for clots to travel to the lungs, creating a life-threatening emergency. Prevention focuses on maintaining regular movement, staying adequately hydrated, and avoiding prolonged immobility. During long travel or bed rest, perform leg exercises and change positions frequently. Compression stockings can help prevent clot formation in high-risk situations. Cause 10. Sleep apnea and poor sleep quality. Sleep apnea, a condition where breathing repeatedly stops and starts during sleep, creates a cascade of health effects that include leg swelling. Poor sleep quality from any cause can disrupt hormones that regulate fluid balance and stress your cardiovascular system. Sleep apnea forces your heart to work harder during the night, potentially leading to heart failure over time. The condition also affects kidney function and hormone production, all of which contribute to fluid retention that becomes visible as leg swelling. Untreated sleep apnea increases your risk of heart disease, stroke, and diabetes while contributing to daytime fatigue and leg swelling. Proper treatment improves sleep quality, energy levels, and overall health while reducing fluid retention. We've explored 10 silent causes of swollen legs that affect millions of seniors worldwide. From circulation problems and heart issues to medication side effects and sleep disorders, these causes often develop gradually and can be addressed with proper knowledge and action. Remember that leg swelling isn't just a cosmetic concern or an inevitable part of aging. It's your body's way of communicating that something needs attention. The good news is that most causes are manageable with appropriate lifestyle changes, medical care, and consistent effort. Start by paying attention to patterns in your swelling. Notice when it's worse, what activities help or worsen it, and any accompanying symptoms. This information becomes invaluable when working with your healthcare provider to identify and address the underlying cause. This video is intended for informational and educational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. If you experience any symptoms, discomfort, or health concerns, please consult your doctor or a qualified healthcare provider. Always speak with your doctor before making any changes to your diet, supplements, or lifestyle. If you found this information helpful, give this video a like and subscribe to our channel. Thanks for watching, and I'll see you in the next video where we'll continue exploring ways to help you live your healthiest, most active life.